Hi, Dr. Minkoff here. I want to tell you about a therapy we do at LifeWorks Wellness Center, which is called EECP. Here's the book on it if you want to look this up. EECP stands for Enhanced External Counter Pulsation. Now, what does that mean? This is a therapy that was developed for people who had blocked arteries in their heart and other places, who were then getting symptoms. So when you get blocked arteries in your heart, you could get chest pain, you could get arrhythmias, you could get chest pressure, you could get pain into your jaw or pain down your arm, and it may be a sign that you have arteries in your heart that are blocked. The usual approach to this would be to see a cardiologist, get catheterization, see if they're blocked, and if you have blocks, there's some options where they might put a stent in there, they might do open heart surgery and bypass it. But another way to treat this disease is to do EECP. Now, what happens with it? It's a table. You lay on the table. There are things that look like blood pressure cuffs that go on your calves, on your thighs, and around your lower abdomen. It's timed with your heartbeat. So the heart has a 2-stroke beat. So when the heart is in the relaxed phase, which is it's like opening up to get more blood, the blood pressures cuffs in sequence from your lower leg, upper leg, lower abdomen, they go like this, and they send a wave of blood up into your heart, up into your brain, and that wave actually turns on a hormone in the body, and that hormone, it's called endothelial growth factor. It makes blood vessels that are blocked grow new ones around the block. And so when you get new blood vessels around the block, you get blood to the heart muscle that wasn't going before. And it really takes the symptoms away of blocked arteries or chest pain or angina. The usual treatment course is 35 treatments. They're done 5 days a week in a row. They take an hour. You lay on the table, the thing bops up and down. Some people listen to music, some people read, some people fall asleep. It's not painful. It's very effective. Usually by 17 or 18 treatments, if the person has had chest pain, their chest pain goes away. So as an alternative or something to do before you get your heart bypass, unless it's an emergency, or your stent, again, unless it's an emergency, this treatment is really good. We haven't had one patient, we've been doing this treatment for probably 8 or 9 years, we haven't had one patient where it wasn't effective. Their heart actually performed better, functioned better, their chest pain went away, and it's been really good. The other thing that it's good for is sometimes people have a heart muscle that just can't pump enough. They got a viral infection, or they had a heart attack. And instead of pumping out, this thing is called ejection fraction, instead of pumping out, say, 55 or 60% of the blood in the heart, we've had several people come in where they were only pumping out 20%. And at 20%, it's very hard to walk around because you just don't have the energy to be able to do it. In each case where we've had this very low ejection fraction, by the end of the 35 EECPs, they've had a doubling of their ejection fraction. So if it was 20, they went to 40. We had one guy who was like 13, he could barely walk around, he went to 27. So this can also help that. On people sometimes have decreased circulation in their brains with Alzheimer's or MS, and this also improves circulation to the brain. So we may use it in instances where people have those diseases, and we will do EECP even though we don't actually see cardiac disease. Okay? So this treatment's very safe, it's very effective, it's FDA approved, and it's really good. It's called EECP, and if you have cardiac disease or you have symptoms of brain problems, we can talk to you about it and see if it's appropriate for you. Okay? Hope this helps.